This is a presentation for the Counseling the Culturally Different class. The instructor is Dr. Karen Ferguson. I am the student, Shane Linder. This presentation is going to focus on counseling LGBTQ plus individuals. Let's go through a brief history of homosexuality. It was a common practice in parts of ancient Greece and ancient Rome. It became forbidden by the Christian Church after the time of St. Augustine, which was 400 of the current era. The Justinian Code of 529 CE forbid homosexuality and carried the death penalty for unrepentant offenders. Now, as we got into the Industrial Revolution, children started spending more time at school during the 18th and 19th centuries. The transgenerational sex became rare. Same-sex relationships became primarily of the same generation. Into the 19th century, medicine and psychology began studying homosexuality, leading it to be thought of as a medical condition rather than a moral condition, at least within the scientific community. The society at large still viewed it as a moral condition, but the scientific community started viewing it more as a medical condition. Acceptance of homosexuality became more common during the 20th century. The American Psychiatric Association removed it from the list of mental disorders during the 1970s. Attitudes have been changing. In 1985, 89% of the public indicated that a gay child would be upsetting to them. 30 years later, 39% of the public indicated that a gay child would be upsetting, and 57% indicated that it would not be upsetting. Less than 10 years now after that, the number has come down to 27% of the public indicating that a gay child would not make them uncomfortable. The entertainment industry has had a lot to do with this change of attitude. Ellen DeGeneres came out in April of 1997 on the TV sitcom Ellen. And the following year, NBC came out with Will and Grace, a TV show that was normalizing homosexuality. These may well have impacted some of these numbers as it put it in front of the public. But it's not just the entertainment industry. We have also seen organized religion take positions that are more accepting or affirming of homosexuality. In 2000, the Church of England, which is the Anglican Church, approved transgender priests. Then in 2005, they approved gay priests. In 2009, the Evangelical Lutheran Church in America, ELCA, approved ordaining gay pastors, and that's the largest Lutheran synod in the United States. In 2012, the Episcopal Church of the United States approved ordaining gay pastors. So both the entertainment industry, which has a huge influence on the public, and organized religion, which also has a very significant influence on the public, have contributed to the change of the attitudes that we are seeing in society. So sexual identity, the sexual orientation awareness normally comes about in the early teens. The teens start realizing that, if they're a boy, all their friends that they used to hang out with, about the time their friends are noticing the opposite sex and talking about girls and wanting to get with girls, that they don't fit in with that. They're not attracted to the opposite sex. And the sexual experience and identification takes place more in the mid-teens. So we're talking like 15 to 17 years old, that they start to have their first experience and start to think of themselves as gay or lesbian. a same-sex relationship where they actually start dating somebody of the same sex. Typically that's the late teens, early 20s, so around 18 to 25 years old is when the individuals start getting into actual relationships. Now, in 2022, we see that 7.1 of the U.S. population is LGBT, but look at this, 21% of Generation Z identify as LGBTQ. So what we're seeing is that as the acceptance of this comes about, more and more young people are willing to come out and let people know what their feelings are. 57% identify as bisexual, 21% as gay, 14% as lesbian. So those two numbers combined there would be 35% would be gay or lesbian, 57% bisexual, 10% transgender, 4% are identifying in another way. So Kinsey's scale gives us an idea of the spectrum of same-sex attraction. Instead of just having the three options of heterosexual, homosexual, and bisexual, Dr. Alfred Kinsey developed a heterosexual homosexual rating scale in 1948. It goes from 0 to 6. There is an X category, which is not shown on the spectrum here, and that is when there is no socio-sexual contact or relations. Now, there are limitations to this scale, and one of those limitations is that it does not include pansexuals, demisexuals, or transsexuals. Well, a pansexual is somebody that is attracted to all genders. And a demisexual is somebody that is only attracted to somebody after they have formed an emotional bond with them. And a transsexual, of course, is somebody that is identifying as the opposite gender of their birth gender. Now, to explain another limitation of the Kinsey scale is that the Kinsey scale makes it look like homosexuality is the opposite of heterosexuality, and you have this line with homosexual being on one side and heterosexual being on the other side. However, they're actually independent constructs. So that's to say that homosexuality isn't necessarily the opposite of heterosexuality. To use a metaphor, consider this, the desire for sweets. Some people really like sweets. Their favorite snack foods are sweets. However, other people really like salty snacks. So what type of person are you? Are you a person that likes sweet snacks, or are you a person that likes salty snacks? You see, salty snacks is not necessarily the opposite of sweet snacks. And some people may like sweet snacks exclusively, while other people may like salty snacks exclusively. And then there's some people that would like both salty and sweet snacks. And then there's a spectrum in between there. Like some people, most of the time they like salty, but sometimes sweet is good. Or most of the time they like sweet, but sometimes salty is good. And this would be a metaphor for sexual attraction. You've got same-sex attraction on one side and opposite-sex attraction on the other side, but they're two different constructs. Now, when we start talking about gender identity, that's kind of like the car you drive. That gender identity has little to do with sexual orientation. So you might like salty snacks and drive a Corvette, or you might like sweet snacks and drive a Cadillac, but the fact that you like sweet snacks has nothing to do with the type of car that you're driving. So in the same way, sexual orientation and gender identity are two different constructs as well. And just looking at the Kinsey scale, that isn't that clear. So the Kinsey scale is useful so that it shows that there's a wide variety of sexual attraction and sexual orientation. There's not just 3 choices, but there are limitations to the scale. Now, transgender, the DSM changed the condition's name from gender identification disorder to gender dysphoria. So, gender dysphoria is a mental impairment which creates distress resulting from the incongruence between a person's identity and biological sex assigned at birth. The issue that counselors help people deal with is the distress that they feel. So the fact that they are identifying as a gender other than the gender that they were born with is not the issue so much, but rather the stress or distress that causes. The experience of gender dysphoria is no longer considered a disorder. However, it is a mental health condition. You know, it's just like when, it's not exactly like this, but this is an analogy. When we lose somebody to death, say our child dies or our spouse dies, that grieving process is a mental health issue. It is something, the grieving process is something that a lot of people go to a counselor and they get help with. But it's not a disorder, but it is a mental health issue. And in the same respect, gender dysphoria is a mental health issue that a lot of people dealing with it need help from a counselor to deal with that issue. But the gender dysphoria itself is not classified as a disorder. Identity issues revolve around the internal perceptions which contrast the external perceptions. So what are some of the LGBTQ plus stressors? Well, discrimination at school. If you're working with any students that are in junior high or high school or college, oftentimes there is discrimination not only from other students, but from faculty and from teaching. And these are issues that individuals that are LGBTQ plus are dealing with. Also harassment at school or at work. Harassment most likely, or most often I should say, is coming from peers. However, it can also come from teachers and administration, the boss in the work environment, could even be clients, customers, where a person works at. Rejection. This can also deal with family, it can deal with friends, it can deal with multiple social situations that the LGBTQ plus individual is dealing with rejection. Identity non-affirmation. This is where somebody refers or refuses to accept the identity of somebody, if they are gay or if they are transgender. And this again could be somebody in authority like a teacher or a boss, or it could be peers like friends, or it could be family members. And this causes stress for the individuals. Victimizations. Oftentimes LGBTQ plus individuals are victims of crimes. Counselors at times will need to show active support. And that means not just listening to the client and what they are experiencing, but getting involved at some level. This often involves speaking with teachers and school officials. That can be by calling them on phone, contacting them through email, or sometimes it may mean actually getting in one's car and driving over to another location to interact with them and talk with them to try to help the situation or the environment that the LGBTQ person is in. Create or make referrals to support groups. Support groups are very helpful for LGBTQ plus individuals. If you know of such support groups in your area, you can refer patients to them. If you don't know of any, you can maybe find some online and refer them to online support groups. Or you could form a group yourself for these individuals. The support groups, one thing that they do is they help normalize the situation that the LGBTQ plus person is in. When they can sit with other people and talk and realize that other people are dealing with the same things that they're dealing with, it gives them a sense of normalcy, and that helps their self-esteem and helps their self-assurance, that they don't feel so alone and isolated. So support groups are a great mechanism to help those experiencing some LGBTQ plus issue. And if there aren't any, then we can create some so that that support is out there. Also encourage changes to the school curriculum. Remember, 21% of Generation Z are identifying as LGBTQ plus. That's 1 in 5 individuals. This is an issue that should be part of school curriculums so that as we are raising future generations, they are learning how to interact appropriately with LGBTQ plus people so that we can all get along. That's what leads to a productive, safe society for all of us. And then work with law enforcement and legislative groups to pass and enforce laws protecting sexual minorities. There are many times that therapists have opportunities to work with law enforcement or legislative groups where we can support laws that are protecting sexual minorities. Now, family support. Family support is another big way to help LGBTQ plus people. Coming out. If someone identifies as LGBTQ plus and they come to you for help, one of the first things we need to ask is if they have come out already. This can even be put on the intake form. Depending upon their circumstances, they may not want to come out right away, and it might not be in their best interest for them to come out right away. But that is something that the therapist or the counselor can help the individual with. Parents are going to have, or many parents are going to have, a feeling of loss, almost like their child died. Well, their child didn't die, but what they thought their child was died. The image that they had of their child, the identity that they had of their child, that died. And so the parents are going to go through a grieving process. And they can use some support. If not all of them are going to be willing, but if they are willing to get involved in some type of therapy, that would certainly help the family as a whole. Meeting gay and trans partners. This is another area where parents sometimes need help before they meet their child's partner. And sometimes the LGBTQ individual needs help in their relationship with their partner. Telling family and friends and extended family members. How can the LGBTQ person tell their family, tell their friends? Different situations are different. In the work environment, if they have a job, how do they tell their coworkers? How do they tell their boss? If they're in school, how do they tell the other people at school? If they are involved in some type of extracurricular activity like sporting events or social clubs, how do they tell them? If they belong to a church and they're in a faith group, how do they tell them? The individual dealing with this may need help and guidance from a counselor. And then, of course, the religious life. If there's a conflict there between the homosexual or transsexual identification and their religious life. Now, as we saw, there's more and more religious organizations that are affirming organizations. And so this is not always an issue. Many of the clients that come to a therapist for help dealing with LGBTQ plus issues are in the membership of a religious organization that is an affirming organization, but some of them aren't. And it's not always so easy just to switch churches. Sexual assault. A 2021 investigation in the UK revealed that 45% of gay and bi men had been sexually assaulted. That's huge. So that means if a LGBTQ plus individual comes to you looking for help with something, there is a very significant chance that they have been assaulted. 37% of those assaulted felt that they couldn't talk to anyone about it. That leads to more problems if they can't talk about it. Only 14% had reported the assault. And so that tells us that some of these individuals that come to us for help may need support in reporting the assault. 19% stated a sexual partner had removed a condom without their permission. And that tells us that some of these LGBTQ plus individuals need to learn about boundaries and setting boundaries and how to enforce their boundaries when they are violated. 28% stated that they had sex while too drunk or high to consent. I saw a statistic way back in the 1990s that the majority of girls, this was back in the 1990s, that got pregnant outside of wedlock were under the influence when they got pregnant. People do things when they are under the influence that they wouldn't do if they were sober. And in this case, we could be talking about unsafe sex. A 2021 study found that 63% of bisexual, 49% of lesbian, and 35% of heterosexual women reported experiencing rape during their lifetime. So it is just as prevalent, more prevalent among lesbians or gay women as it is among gay and bisexual men. So this is like something that a counselor really needs to ask about when they're working with somebody that is LGBTQ plus. Now, aging in the LGBTQ plus community is an issue, and that is also something that counselors need to deal with when they are working with people in the LGBTQ culture. Older LGBTQ individuals underutilize healthcare facilities. Well, they don't always get treated right when they go to the doctor, so it gets to the point where they don't want to go to the doctor. They may need some encouragement or, again, some intervention on the part of the counselor, where the counselor may need to reach out to their primary healthcare provider and talk to them about how the LGBTQ plus individual is being treated. Discrimination occurs in medical facilities against LGBTQ plus patients. As you know, many doctors have waiting lists when you go into the waiting room, and you can sit in the waiting room for 20 or 30 minutes, or you can sit in the waiting room for 2 or 3 hours before you get in there. And when LGBTQ plus patients are discriminated against, then they are discouraged from utilizing those services. Discrimination also exists in retirement communities. So a lot of these communities are set up for the elderly, but when the LGBTQ members join, they have issues of discrimination there, especially in the older generations. As we saw, the younger generations, Generation Z, 21% are identifying as LGBTQ. But in the older generations, we have baby boomers and Gen Xers, and there's a lot less percentage of LGBTQ plus people in those generations. So they deal with more discrimination in retirement. Well, what are the implications here? Older LGBTQ individuals may need to come out again when they enter into medical facilities and retirement communities. That is, they're not in the closet, they're out, their parents know it, their friends know it. Well, maybe their parents have passed away, but maybe not. Their family knows it, their peers know it, but now they're going to the hospital or to a medical clinic, and those people, don't know it, and it's like another coming out again process. If they're moving into an assisted living place or into a nursing home place, then they need to come out again and tell people. LGBTQ clients may need resources such as Gay and Lesbian Association of Retiring Persons. Some of those organizations may also provide them some support that is helpful. So what are the implications for counseling here? Coming out factors. Again, I mentioned earlier that helping somebody come out, there's a number of things to consider. Those include age, ethnicity, the relationship status. Are they in a relationship currently with somebody? Also, the relationship status that they have with the people they're coming out to. So if they're telling their parents, what type of relationship do they have with their parents? And then, of course, their spiritual beliefs. Role play. The therapist can role play with the client to help prepare them for coming out. Help parents and family members support or find support. Because again, they're going through a process of grieving. They have lost the identity of what they thought their child had. And so they're going to need time to adjust to that and to deal with that. Look for mental health conditions like low self-esteem, depression, anxiety, and suicidal thoughts. These are issues that people experiencing LGBTQ issues deal with. And so this is something that a therapist should be on the lookout for. Many LGBTQ plus individuals experience internalized heterosexualism. This should be worked through so they can transition to identity acceptance. There are multiple phases to developing our cultural identity, and the LGBTQ plus is itself its own culture. And so as the person is developing this identity, in the beginning of the process, they're going to have this internalized heterosexualism, and they may hang on to that for quite a while. And that's going to make them feel like they're less than, like something is wrong with them. And so part of the job of the therapist is to help them work through that heterosexualism so that they can accept themselves for being the way they are and who they are. More implications for counseling. Clients that are dealing with internalized homophobia need help replacing heterosexual messages with affirming messages about their identity. This is a big part of working with individuals that are LGBTQ+, is that they are judging themselves based on society's belief, based on what they have observed and learned is society's belief. And that homophobia from the society has become internalized. And so then they are judging themselves based on that. And the therapist can help them transition away from that internalized homophobia and get some more affirming messages about their identity and who they are. We help clients identify cognitive distortions, practice coping skills, and expand social supports. Cognitive distortions is what people in recovery call stinking thinking. And this is a big part of getting away from the internalized homophobia, because a lot of these cognitive distortions that the LGBTQ plus individuals are experiencing are due to things they have learned from growing up in the society that they grew up in. And so they're judging themselves and they're repeating these things, society's messages that are not necessarily true, they're not necessarily accurate, and they're not moving the individual towards self-acceptance. Practicing coping skills, many of these LGBTQ plus individuals will need help developing coping skills and then practicing them and expanding social supports, finding places where they can get support socially. Transgender clients may need specific help with name changes and finding local support groups. Again, the local support groups, I cannot emphasize that enough. Very, very important. Name changes, they may need help with some of the legal issues of changing their name. They may also need help and some coaching on how they're going to deal with family members, with employers, with coworkers, with the school, as far as changing their name and how that can be done so that it doesn't cause so much stress, a tranquil way of managing this. When working with LGBTQ couples, they will have similar problems as heterosexual couples and some unique problems. So a therapist, we need to talk to them, we need to ask them a lot of questions and have some cultural humility, that we may not exactly understand the situation that they're in. So that's why we need to ask questions and we really need to listen. More implications for counseling. Prejudice, discrimination, and internalized homophobia produce stress. And that is what the counselor will be dealing with most of the time when they're working with a client in the LGBTQ plus culture. That client will more than likely be dealing with prejudice, discrimination, and internalized homophobia. Leaving one's religion that is non-affirming reduces internalized homophobia, but increases risk of suicide. It is very tempting for a therapist or a counselor to recommend that a client who attends a non-affirming church to leave that church and just go to another one, like the Episcopals or the Lutherans that are affirming. I'm talking just, for example, about churches like the Catholic Church or Southern Baptist Church. Those are non-affirming churches. And part of the reason that the client has internalized homophobia is because of messages that they have been getting throughout their life from that non-affirming church. And so it would seem to make logical sense that they leave that church and go to an affirming church. But what we see is that their risk of suicide increases. So that is really not something that the therapist wants to recommend. Those belonging to non-affirming religions that do not wish to change but may make sexual abstinence a goal to achieve congruence. Now that is something that came out of the American Psychological Association, a task force that they put together back in 2009. And that was one of the suggestions that they had, that it may be a better option for the individual to practice sexual abstinence rather than ditching the Catholic Church or the Baptist Church and going over and worshiping with the Methodists. While that may be difficult for some people to understand, we're dealing with multiple cultures. The LGBTQ plus community is one culture. The Catholic community or the Baptist community is a completely separate culture. And so sometimes we get clients where they have two different cultures battling each other. And the best case scenario is where we can help them work through it so they don't have to leave either culture. They remain in the LGBTQ plus culture, and they also remain in their Baptist or their Catholic culture. And one of the ways that that's possible is what was being suggested here, was sexual abstinence. Individuals choosing abstinence may need help nurturing supportive social relationships, much like couples need help maintaining a healthy marriage. And what we see there is that many times people in this situation, they may be a Baptist or Catholic, and they decide that they're going to be abstinent and live a life of abstinence. But after a year or 2 or 5, things don't work out too well for them, and they have problems. Well, one of the things we see here, our suggestion is that it's just like a marriage. Man and woman marry each other and things are great, and 2-3 years later they have marriage problems, or 5 or 15 years later they have marriage problems. And in the same respect, somebody that's living a life of abstinence may have times during their life that they have issues and they need help to nurture supportive social relationships, because human beings are social creatures where we can't isolate. We need other people. We need to love. It doesn't necessarily need to be sexual love, but we need affirmation. We need love, and we need people to love us for who we are. And that may be a situation where somebody in the LGBTQ plus community needs help from a therapist or a counselor in maintaining or those nurturing, supportive social relationships. Mutual help support groups have been shown beneficial for the LGBTQ individuals with religious convictions, both affirming and non-affirming. And that again comes out of that APA task force. And they looked at both people that go over and they worship with the Methodists or the Episcopalians, the LGBTQ people that are in a church that is an affirming church, and those that decide to stay with the Baptists and the Catholics in the non-affirming church. Both of those groups of people benefit from mutual help support groups. And there are mutual help support groups, separate groups of course, that help the affirming and that help the non-affirming. And that is important to the mental health of the individual, is to find one of those support groups where there's other people just like them, and that really creates a sense of normalcy too. That they're not the oddball, that they're not the black sheep, that there's other people just like them going through the same thing that they're going through. Now, counseling considerations. Do not pathologize LGBTQ behavior. That's one of the things that we want to have a tendency to turn some of their behavior into a pathology, like it's an illness, that something's wrong with them because of this, and we should not go there. Beware of diagnostic overshadowing, and that is where they have more than one issue going on: depression, anxiety, low self-esteem, whatever it might be, and we let one item, we focus too much on one item at the sacrifice of the other items. Beware of attribution error. And some of the clients are, they want to figure out why they're gay or why they're transsexual. And that may not be that important, why they are. It's finding coping mechanisms and dealing with the reality of today. There may be other issues they're dealing with of depression and anxiety, low self-esteem. And we can also get caught into attribution error where we're trying to attribute the cause to something that, and it's not that important. It's more important dealing with the issue that they're dealing with. Beware of confirmation bias. And we're all guilty of this. We all have confirmation bias, and that is that it's very easy for us to believe something that we're inclined to believe, and very difficult for us to believe something that we're not inclined to believe. Yeah, so a client comes in and right off the bat we think that they're depressed, and in reality they're not depressed. But because we already decided that they were depressed when they came in, we're very slow at realizing that their issue is not depression, that something else is going on. So one of the things we can do as counselors when we're working with the LGBTQ plus community is emphasize the positive aspects of a gay or lesbian lifestyle. One is a supportive community, and sometimes they need help finding that community and maintaining a nurturing relationship with that community. But there are supportive communities out there for LGBTQ plus people, both those that are religious and non-religious. There are supportive communities for them, and that is one of the positive aspects of being gay or lesbian. They can create families of choice, so they can adopt children, they can have foster children, they can or they can decide not to have any children at all. They create their own families of choice. There's no accidents where somebody accidentally got pregnant and now we've got 18 years of child support in front of us. Be positive role models. And the gay and lesbian people, they can be positive role models in their community. They can be positive role models to other people in the LGBTQ community. I've known of some of them that have gotten with the YMCA Big Brothers and Big Sisters programs and have really made a difference in the lives of young children. If they are involved in a community of faith, they can be positive role models in that community of faith. Be involved in social justice activism, and of course there's many opportunities for them to get involved in social justice activities. Freedom from gender-specific roles. Once they get past that internal homophobia, they find the freedom from gender-specific roles. This is the bibliography for this presentation.